Hello and welcome to the NTI PodTalk. My name is Dianne Koehler and I'm Director of Nutrition Therapy Institute. Join me as I talk to interesting people in the field of health and wellness, food and farming, and anywhere else we find conversations that matter to our community. By listening, you'll learn a little about NTI and a lot about the things and people around you that make a difference for your wellness. Welcome and let's get started. Hello, everyone. Welcome back to another edition of the NTI PodTalk. This is Dianne Koehler, Director of Nutrition Therapy Institute. And today I'm very excited to have another wonderful conversation with a doctor in the field of holistic health, Dr. Jessie Miller. Welcome, Jessie. Thank you so much for being here.
Thank you for having me. I'm very excited.
Yeah. So you are a naturopathic doctor, and I want you to explain what a naturopathic doctor means in comparison to a naturopath or a functional doctor. You know, there's all these words, all this terminology that's kind of out there. And I think some people are a little confused. So I would love for you to talk about what actually is your training as a naturopathic doctor and kind of tell us about those differences.
Sure. Yeah, that's a great question. It is. I'm from the Midwest, so I go home and most of my friends still don't really know what I do. So yeah, and I got some of this wording. I'll be reading a little from a script because I think that it's nice to hear from our association. They put it together so well.
Yeah.
So naturopathic doctors are trained in primary care medicine, and we have an emphasis on the art and science of both natural and conventional healing modalities. So I like to describe myself kind of like a bridge between conventional and alternative medicine. So I kind of take the best of both worlds a little bit. In terms of kind of meet you in the middle. Most people seek me out, obviously looking for just a different way to approach medicine, a different way to approach the complaints and the symptoms that they're having for multiple reasons. They haven't got the results they wanted, maybe with their primary care, or they're just initially, that's the way they like to live their life. They'd rather use more lower interventive modalities like things like herbs nutrition first. So that's what we're experts in as naturopathic doctors. Our 4-year doctorate medical education, it's both comparable and complementary to that of an MD, medical doctor, or DO, doctor of osteopathic medicine, right? Those are other terms that, I think people are more familiar with when they hear, like, I'm going to the doctor. Those are the two doctors you're typically going to see.
Mm-hmm.
It requires an undergraduate degree and pre-med requisitions to get into this school. And then we have a board exam upon completion of our schooling. So, like I said, it's a 4-year degree. You can do it in longer. Some people add on other, like some people also add on acupuncture or other things. So you may meet an ND who is a naturopathic doctor. ND, they also might do acupuncture. They also might be a midwife. We like to kind of do lots of things.
Mm-hmm.
So some people are in school for up to 6 years if they're kind of having those additional trainings. So I feel like where it veers, so our schooling pretty much mirrors that of an MD or DO in terms of the biomedical sciences, the kind of more rigorous, like in school book learning, I guess I would call it. We have same amount of clinical hours. We have every school is attached to a clinic in the city it was in. So mine was in Seattle. So we were in the clinic treating patients from starting in year 1. And then by the 4th year, we're doing that basically on our own. Where it diverges, is that the word? Yeah.
Mm-hmm.
Would be more our modality. So what are we using to treat people, whether it's their complaint or just how our approach is in general to their health. We get additional training in herbal medicine. So all 4 years we're learning herbs, nutrition, deep dive into nutrition, counseling. We have actually quite a few quarters of counseling strategies, so we can really our bedside manner is really good, and we can really start to help people kind of motivate to make these changes in their life, because a lot of what naturopathic doctors ask of is it's changing habits, right? It's like lifestyle habits. So we learn kind of how to help people do that. We also learn a lot of physical medicine. We learn homeopathy, and then a lot of mind-body techniques. A lot of my friends went on to learn biofeedback and things like that. So in essence, it's a very holistic view on the person sitting in front of us and our approach. And so what that looks like too is if you came in to see me, our visits are much longer than a typical MD or DO. We're spending 90 minutes in that first visit. because it takes me a long time to get to know the person in front of me, both their physical self, their mental self, their emotional self. So, yeah, that's kind of my long-winded answer because, and I could obviously keep going, but that's what a naturopathic doctor is. And you asked about different terms.
Well,
So
yeah, I think that there is, so naturopathic doctor, and then I've heard people say I'm a naturopath, but they didn't go to naturopathic doctor, they don't have naturopathic doctor training. At least that's my perception, and I could be wrong, but or I trained in naturopathy, which is not naturopathic doctor. And so what I think is different there is that they don't actually get that academic medical training in their schooling.
Yeah, so everything I was just describing in terms of where I went for those 4 years and the clinical training and all that, that's only at certain educational schools throughout the country. There's 6 of them. And we are then, like I said, then we take a board exam that's across the board the same, right? So it's a very comprehensive training. Naturopathic medicine goes way back. It's actually one of the first ways that we treated people before the MD world came on in like the early 1900s. So it's hard now because we kind of come back as not a new profession, it's actually the oldest profession, but now we're getting ourselves, we're digging our heels into the medical community because we're really good at preventive medicine. We're really good at primary care medicine. So that's where the confusion, because there are people who have studied naturopathic modalities. They've studied naturopathic medicine in the way that it traditionally was taught and is still being taught in schools. So they've learned a lot of that, like what's finding the root cause. They're using all the same modalities. They just didn't have the rigorous training that we did because we wanted to like overlap with primary care. We want to be primary care, but we want to take it in a different approach. So when someone says I'm a naturopath, they could still be a naturopathic doctor. We sometimes use that interchangeably. You have to kind of ask, oh, where did you go to school? If someone says, now in some states, that's a protected term. So to call yourself a naturopath or a naturopathic doctor in Colorado, it's actually illegal to say that if you didn't go to a school. So that is helpful. Some states now have licensure and we have protected terms. And there are online degrees. Basically, you can go online and you can get a degree in naturopathic medicine and take a board exam, it's completely different, doesn't have the same training, but that person still may be a great healer. Like, I don't like to knock it, it's just different. So I think it is important for people to know what they're getting.
Yeah.
Yeah.
I think what catches my attention and what's really important from what you just said is that naturopathic doctors are great at preventative medicine. They're great at being primary care physicians. And I think that's so important because so many people recognize, whether they are currently, currently have some sort of health condition, they recognize that even if they aren't sick right now and they don't have to go to the doctor right now, they know that they want to opt out of that system sort of altogether, unless it's, car accident, emergency, go to the emergency room type stuff. And so they are going to be seeking out someone who is more preventative in nature. And I think that's so important about the field that you're in, because you get that medical training. It's almost like a double degree, because you get that 4-year medical training, but you add on the additional layer of all of these more holistic approaches. And I think that's fascinating. And I think that's really important for those people who, as I said, want to opt out of the conventional system that we now have. So
yeah. Me too.
Yeah. So, and how long have you been practicing?
I had to think about this. I'm in my 6th year of practicing here in Colorado. So I graduated in 2017 from Bastyr.
Nice. Okay. All right. So, we just talked about all these different modalities and having a more holistic approach. Was there something in particular for you that inspired you to pursue this training?
I don't have like a lot of my friends have personal health stories, right? That kind of
Uh-huh.
brought them into this way of treating. I don't have a personal health story. I always wanted to be a doctor. I wrote it in my little journal in kindergarten. I still have that. So I was on the pre-med path. I came here to Boulder to get my undergraduate, and I just living in Boulder, my eyes were opened to all the different ways of healing. I was realizing there was another way to approach medicine and to approach healing, and there's all these amazing, I started going to see a chiropractor. I started working for an acupuncturist. I was a physical therapy aide. So I was kind of just like dipping my toes into all these different healing modalities. And so in about my second or third year of undergrad, I found naturopathic medicine by Googling root cause of medicine, because I was like, everything's a band-aid. The approach, they're just putting band-aids on symptoms, and it's not, people aren't happy, it seemed like, what I was experiencing, at least around me. And so I Googled what's the root cause of medicine, and Bastyr University's website came up, and I was like, oh my gosh, I can still be a doctor, but I can treat the way with my philosophies and the way that I actually feel like might actually help people long term. So
Mhm.
and then I just went. I just
Yeah.
I just bought in and went, and that's my story.
Yeah, yeah, absolutely. All right, good. So do you have a particular focus in your practice or specialty that you are known for?
I do. I focus on three main things: women's health, pediatrics, and the digestive system. So women's health is it's a large umbrella, but under that, I would say most things are going to be related around balancing hormones, balancing cycles, certain uterus related symptoms. And then I have a special passion around fertility, preconception, and then just the whole perinatal period of someone, from getting pregnant to postpartum.
Hmm. Great. Okay. All right. So, as you know, we are a nutrition school. And so we focus a lot on nutrition and, understanding what foods are reliable sources of all the nutrients and those kinds of things. So, you've already mentioned that you get training in nutrition, and nutrition plays a role in your practice. Can you talk about, really what does that look like in your practice? And also, I think it's helpful for us to see, from your perspective as a naturopathic doctor, what kinds of specific nutrition related concerns do you see in your clinic?
Sure. Yeah. Um, so nutrition plays, I would say, the largest role in my practice, because it's so important for as a foundation of health. Um, I speak about the foundations of health. Also, people also call them the determinants of health. That's a naturopathic doctor term. Those are going to be sleep, movement, stress management, water, nutrition, and community. So I'm touching on all of those things like that first visit. But nutrition, I mean, sometimes it's all I talk about it'll take up a whole hour in the visit, depending on where that person's coming to me from in terms of their education around
Mhm.
nutrition and kind of where they're starting at in their nutrition journey. Because I can give them, all the supplements and all the herbs, and we can do, all the fancy testing. But if we're not addressing nutrition, we're not going to get the results that we're trying to get, especially if it's something like diabetes or something that's more like very much rooted. And we know nutrition has such a big impact on that person's body.
Mhm.
So the things that I talk about is just, I know, like I see where the person's at with their nutrition first of all, and then I really just start with just the general balance of what that looks like for them. So that could be how much fiber they're eating. In women's health, fiber is a huge component of balancing hormones. It's a huge component in the digestive system. Obviously, people come to me with constipation, they come to me with diarrhea. Fiber pretty much can help everything. And you need to individualize it, but sometimes
Mhm.
fiber can make things worse, obviously. But so that's a big one. How much protein they're eating.
Mhm.
I have a lot of like athletes and strong people that just aren't getting enough for what their output is. So I talk a lot about that. Talk a lot about balancing just the intake of sugars. So not trying to demonize sugar, but just looking at the overall balance of what they're getting within my pediatric world. That's a big conversation, because with picky eaters, we just have to make sure that, like, if we're giving them bars, it's balanced in sugar and things like that. So just I have like a very overarching kind of what I feel like are the low-hanging fruit that we're making sure that is optimizing people's health as much as we can. And then I do a lot of more condition-specific work with people. So if someone comes to me with, you know, an inflammatory condition, we're working around anti-inflammatory foods. And what does that mean? That for them, we may do food sensitivity testing. We may do elimination diets to kind of figure out, is there a food that's triggering your symptom? Is there a food that doesn't feel good in your body? Sometimes people need that elimination diet to figure it out because we're, you know, they're not as in tune with their body with intuitive eating. And then I talk a lot about balancing blood sugar. So again, within the women I treat, there can be mood issues, there can be sleep issues, there can be adrenal dysfunction, they're not happy with their weight, there can be kind of like this high cortisol picture. So balancing blood sugar comes, I think everyone gets my like handout on balancing blood sugar every day. So just making sure we're eating consistently, frequently, we're pairing it with fiber and protein, just kind of trying to get rid of those spikes basically of blood sugar in our body. That nutritionally it comes in almost every single visit, everything I just said. And then, then there's specific deficiencies. You know, we're lucky to live in a world in an area that's probably less common than maybe other countries. But here in Colorado, I definitely see nutrient deficiencies, and I do testing. So we do lab testing to find those. I get clues on the intake, right? How they're eating is a big clue. Doing a diet intake. I do a diet intake on every person. But specifically, I would say the biggest ones are going to be low iron or low ferritin, low vitamin D, and low B12. And that's because either my women are having really heavy periods, so they're losing a lot of that iron. I have a lot of like vegans and vegetarians that maybe haven't quite optimized their nutrition. So we're helping, you know, replace that B12. And vitamin D just across the board. It's hard to eat vitamin D like we need to with where we are in the angle of the sun here. So just always making sure people are supplementing or really making sure they're eating that vitamin D. Other things with digestive, I see a lot of people with digestive disorders that they could be having a perfect diet, but they're not absorbing the nutrients because their digestive tract is inflamed. Possibly they have something like celiac that they don't know they have yet. You know, it's a range of reasons, but they're not absorbing those nutrients. So we need to discover that and figure out how we can heal the GI so that they can actually optimize what they're eating. Or they're not producing enough enzymes, HCl in the stomach, pancreatic enzymes aren't breaking their food down. So stool testing, I do a lot of stool testing that can be helpful to discover these things of what's going on. But yeah, as you can, I mean, I could go on. So there's lots of places where like overall nutrition is important, but then getting into that nitty gritty too of those deficiencies.
Yeah. And I was going to ask that about testing, like how much, you know, you said you rely on stool testing. And I think that's, you know, a great benefit that you have is the ability to order all kinds of different tests to really get in and see actually, you know, from a biochemical standpoint on that individual person, what's going on with them if you're doing blood work or stool testing or organic acids or something like that.
Right. Yeah, that's that functional medicine piece. So bringing up that last term you use, functional medicine. Naturopathic medicine is functional medicine. There's just a lot of doctors that have been very interested in the way we teach. So they kind of, a spin-off of it is functional medicine. So they get additional training in that, which is more of a biochemical view and an organ systems view of the body with testing and supplements and things like that. So that's more of that functional medicine approach, which most naturopaths are utilizing. And that's where kind of, you hear a lot about testing and all that comes in. But yeah, I love it. I don't need to, I tell people like, I don't need to test, right? Some people are on budgets. It can make it a little more expensive, but it is helpful to dial in that individualistic approach and just kind of get things moving faster in our treatment.
Yeah, absolutely. Sometimes people need to see it on paper.
And there's data people.
Yes.
Sometimes they'll give them the option and they're like, I'm a data person. Let's do the thing. Let's do the test.
Yeah, right. Actually, that's great. Yeah. All right. Well, so some people in our community may know you because recently you were a guest presenter for us, for our community. You taught an introductory class on postpartum depletion. So I would love it not to do the full class over again, but can you tell us, can you tell us a little bit about what is postpartum depletion and kind of why is it important for people to know about this?
Yeah, absolutely. Yeah, that was such a fun presentation. I loved sharing that information. Something I'm really passionate about. Obviously, it's in that umbrella of perinatal health.
Right.
So postpartum depletion, in the simplest of terms, is basically a person who has given birth after 3 months, they're just not coming back to the way themselves. That's how I hear it described a lot. I don't feel like myself. They're left with a myriad of different symptoms. The most common ones I would pick would be fatigue, sleep issues, mood imbalance, and some physical challenges maybe that were not there before, or maybe they were in the past and they resurfaced. So things like hair loss or, yeah, like I said, just kind of a resurfacing of something maybe they dealt with in the past. It's really important for us to know about this because I find that it's so common. I see it so much in my postpartum moms that come to see me, and it's so preventable. Like, I think that it happens for me to a couple of reasons I'm going to go into, but most of them, when I really look at each of the reasons of why this could happen, they're 95% preventable. So I think it's, the more we spread this message, the more we get those resources on board for these birthing people, that we can actually have a much better postpartum period.
Mm-hmm.
So
Well, can I just ask, is there an issue of maybe someone experiencing these symptoms postpartum after giving birth and thinking that, oh, well, this is just what life is like, and having a little bit of depression about that, and maybe like not realizing that this isn't quote unquote, it may be common, but it may not be normal. It's not a normal part of postpartum physiology and, neurochemistry and all those kinds of things.
100%. And we're
Yeah.
told it's normal. So most women, when
Yeah.
they go to their 6-week, post checkup, we get the questionnaire to screen for depression. And that's the big difference between postpartum depletion and postpartum depression. Is depletion is not depression. If you are scoring high enough on that, in that questionnaire, you're probably going to have depression. In that it's a different treatment. It actually should be all the same treatment, plus maybe you need some medication, plus maybe you need this, and that.
Okay.
But postpartum depletion, if they don't score high enough, they're basically told, well, you just need to get some more sleep. You just need to, eat better. You just need to rest more, or whatever it is. So it's normalized in our society. Postpartum depletion is, I think, a main outcome of the way our society is not right now, because we don't take the time to give the mother the rest that she needs. She's not getting the nourishment she needs. She's not getting the community support and the education she needs. So yes, it gets kind of deep ingrained into like how our society is, and that's one of the pieces that we need to change. Kind of a little bit like moving a mountain, but I think the more of us that know about it. But yes, you're right. It's common, but it should not be normal. I'm a big proponent of like, you should not have to feel this way. Same with like really intense, heavy, and uncomfortable periods. Very, very common. Doesn't need to be normal, right?
Yeah. Yeah. Okay. All right. So, once again, without going into all the details that you covered in the presentation, can you talk generally about some of the strategies that you recommend for women who are experiencing this?
Yeah, absolutely. So I kind of break it into two parts. There's the prevention. So like if you are someone who's thinking about being pregnant, or you find yourself you are in the middle of pregnancy, there's a lot you can do right now to prevent it. This is actually the best time to jump in. And then there's, of course, you find yourself already in the middle of it. What can you do then? So within both of these, I kind of use this framework of nourishing, supporting, and educating. It's kind of how I like frame the different ways that we can prevent and treat. So prevention, a lot of it is going to be around well, it's kind of even. We'll start with nourish. Nourishing is involving nutrition, of course, right? Eating for pregnancy, eating enough for your trimester, eating the right types of foods to build you and your baby. Um, and then really focusing on the foundations of health, right? You're moving your body, you're sleeping, you're drinking enough water, you're dealing with stress management. I found stress management is actually a big one during pregnancy, because if you can really hone in on those skills, you will have them for after, when things are going to feel a little more stressful at times. And then supplements if needed. There's a lot of great supplements that can help fill in any gaps that you may be needing in pregnancy, because we're not always eating our best because we can't, or we're really sick, or we just don't want to. Well, there's many reasons. And then supporting is, again, it's around that stress management. It's about gathering your resources. So when we're pregnant, we all know there's like the pregnancy books we can read, what to expect when expecting, all those things. I'm a big proponent of just normalizing birth, normalizing pregnancy, and what it's going to look like postpartum. So it's starting to both educate yourself, but also get your support systems in place. Get your list of people that you can call after. Get your lactation consultant. Get your doula on board. If you want to have a doula, I'm always pushing birth and postpartum doulas. They're so helpful. Pelvic PT. If you have a history of anxiety and depression, you already know that. Get your counselor on board. Start interviewing people. I mean, having those resources on the go, the faster you intervene once you start feeling like you're not bouncing back like you should, the quicker that you can get some treatment on board. So then after birth, it's a lot of the same things. If you haven't gotten those resources, you need to reach out. I like to tell women, like, you can't do it all. You're not an island. Reach out for help. Look into your local city or neighborhood for those postpartum classes, for those postpartum resources. There's a lot of like standalone centers that support that population of pregnancy and postpartum. As soon as you just start to tap into that, it's the floodgates usually open, and you'll get so much support of what you need, whether that's mental health, whether that's physical health. And then, of course, finding someone like a naturopathic doctor or an OB or whoever that doctor is that's really trained in postpartum health, so that we can get you feeling back. So as a naturopath, I'm doing the testing that I know is most commonly looking for those common depletions in postpartum women. It's going to actually be the things I mentioned before. It's iron, it's omegas, eating enough omega rich foods. It's vitamin D, some other ones too, B12, copper. But we're kind of screening all the physical things out. And then we're really focusing on how we can build you up and get you sleeping better, get your support systems in place, get your mental health support there. So there's a lot that goes into it, but I think just getting you to reach out is the first step, and getting you to, if you're not nourishing yourself, right? Like I just mentioned, there's a lot of deficiencies involved. There's a lot of kind of eating for, if you're breastfeeding, there's so much output going out in your life right now. Like you need to get that input back in. So eating enough, drinking enough, all those things. So you need a cheerleader, and you need a help to get through that. You can't do it on your own. Yeah.
Yeah. If you don't mind, I'm going to plug our, not only are we in nutrition school, but we also have a natural food chef training program. And, my son is almost 25 years old, so it's been a while for me, but I can tell you that after my son was born, I did not eat well. I didn't eat well really around my entire pregnancy, and certainly postpartum was no different. And part of the reason why I didn't eat well postpartum is because I didn't sleep. I didn't have enough energy to cook. And I just didn't eat well. And so I am going to put a plug right now for an additional support to be looking for postpartum, is getting a personal chef on board, so that you can have someone who can come in and cook meals even while you're pregnant. I mean, while I was pregnant, my husband was cooking for us, but he tried.
Right. Yeah.
And you know, he had like maybe 4 or 5 recipes that turned out good and that I could actually eat, because I struggled with eating when I was pregnant. And but then after the baby was born, he's like, all right, I'm going back to work.
Yeah. I know.
and,
Support
and
system is
so
almost something.
you know, having someone who can cook those meals in your house, and that's what our you know, our graduates do. They go into your house, they will cook whatever you ask them to cook, they will cook it, they'll package it up, put it in your refrigerator, and all you have to do is heat it up. And
I
so
love it.
I think that's another important resource to add
Yes.
onto that list, is someone to help cook. And you know, we have on our graduate page, we have a resource page for our chefs that are graduate chefs that are interested and willing to do that kind of work. So
Oh, I
I
love
just
that.
wanted to throw that out there.
No, that's huge because, in the longer presentation, I go into obviously strategies of like pre-making foods, packing your freezer as much as you can, getting a meal train set up for yourself. But those things only last so long. And like, yeah, usually by like at the end of month one, everyone's now left, all the foods have run out, and you're like, now actually, that's probably when you need the help the most. So
Mhm.
I love that. That's
Mhm.
so important.
Yeah. Yeah.
Yeah.
Um, all right, good. Well, thank you for going over that postpartum depletion sort of introduction, and maybe someday, you know, we'll have you come back and do that presentation again. I know a lot of people really enjoyed it, so we'll have
Yeah.
to look at doing that again. Um, but one other question that I kind of wanted to ask, to go back to more general naturopathic doctor sort of work. You know, another focus of mine as the director of NTI is always trying to advocate for ways in which our graduates can work in the field that, you know, brings them joy and helps enforce and reinforce what they've learned and how they want to use their skills and all that kind of stuff. And so do you see that there is opportunity for, in, you know, naturopathic doctor offices? I imagine you're very busy, and even though you're spending, you know, 90 minutes, you know, in the first appointment and however long you take on subsequent appointments, do you see that in this field of naturopathic doctors, that there is opportunities to have a nutrition therapist on staff as well, who can do that one-on-one nutrition guidance and create the menu plans and things that are more, I don't know, just solely like, what should you eat for breakfast type guidance, and that would take away some of the maybe more, I don't know if I want to say routine work or something like that, so that you can be, you know, you as a naturopathic doctor, or naturopathic doctors in general, can be freed up to actually do the medicine of naturopathic doctoring.
Yeah, absolutely. I mean, I feel like you answered the question because everything you said is exactly. So, yeah, absolutely. So, most larger naturopathic clinics have nutritionists on staff, 100%. A lot of my colleagues up in the Seattle area, naturopathic medicine there is a lot more robust. They are working as primary care providers. So, there's, 12 doctors on staff, 3 nutritionists. They have lots of, just because it's true. I would love it so much if I could, and this is a plan of mine, and going to, we just have our visit, we have a plan in place, and we know how you should eat, but how do we implement that in your life?
Yes.
So having that 30-minute hour, I don't know how long that visit would be with that, but I feel like sometimes I send people into the world and they're like, I give them all the resources that I know and that I have, and I have, websites and sheets, but having someone sit down with them and really plan that out, it's going to make our success plan so much more attainable. I think the results will be way more faster and way more robust. And I know, like I said, I know a lot of people that utilize that. So 100%.
Yeah.
I think
Okay.
that's
Good.
like the true integrative medicine that we want, right? You can't do
Yeah.
the things like, yeah, we're trained and we
Right.
wear all these hats, but to do
Right.
something really well, I think you need to have those that integrative team together doing that.
Yeah. Well,
Mhm.
just like you were talking about, the team that you need to gather as you're preparing for
Exactly.
pregnancy and postpartum, um, in all health and wellness, there is, opportunity and benefit to having a team approach.
Yeah,
So, yeah.
100%.
Yeah, all right. Well, this has been a fun conversation. Is there anything that you wanted to get out that I didn't ask about before we talk about your contact information and social media outreach and that kind of stuff? Anything that you wanted to kind of share with our audience that I didn't ask?
I don't think so.
Yeah, there doesn't have to be. I just thought
I know.
just
I
in
was also
case.
just kind of doing the rake of the brain. I'm trying to think of anything else in terms of
Yeah.
what I do or what people can know. I guess one thing is that you don't have to choose between a naturopathic doctor and an MD or DO. Like we work alongside them, right? Especially here in Colorado, we're still working on some of our scope expansion. We don't have pharmaceuticals in our formulary right now. I think we're getting there. So I think it's a lovely way to still have your primary, and you can have those people for more of the serious urgent care issues, but then I think utilizing naturopath as your first stop, and that it's just a nice like blend. Again, getting back to that team approach, like you don't have to choose one or the other
Mm-hmm.
necessarily.
Mm-hmm.
Um,
I love that, and I'm so glad you said that, because oftentimes I think people take this as an antagonistic.
right.
They
Yes.
think of it in an antagonistic relationship where it's either one or the other. And I love how you say that these two things are complementary. So
Right.
it's not necessarily alternative, meaning it's either one or the other. It's
Mhm.
more complementary and overlapping and integrated. So I'm so glad you brought that up. Thank you.
Yeah, and it shouldn't be called alternative medicine. It should be called complementary medicine, right? Because they kind
Yeah.
of put that acupuncture card all under that umbrella. It's like that's a much better
Yes.
term.
Yeah. Yeah. Absolutely. Yeah.
Yeah, no, this has been
Um,
super fun.
yeah. All right. Well, so tell us, how can people find you? Contact information, website, social media, whatever you want to put out there.
Sure. Yeah, I have an office in Wheat Ridge, so it's right on like Kipling and 44th, and you can find my contact information on my website. My website's going to house kind of everything in one place. So that's www.drjessiemiller.com. So it's DRJESSIEMILLER.com.
Okay.
I do free 15-minute consults. So if someone just wants to chat first to make sure we're a good fit, I love doing that. And there's a book appointment button from my website. It's all virtual that way. And I have Instagram and all that. I'm just not very active on it, but it's
Mm.
at Dr. Jessie Miller on Instagram and Facebook. And yeah, I would love to chat. If anyone has any follow-up questions, I'm definitely here. Just give me a call or send me an email.
Great, good. And for those who are not local here, Wheat Ridge is in Colorado. So she's located in Colorado, and we have a lot of people in our community, students and grads who live in other states. So I just want to clarify that we're talking
Yeah,
about
Denver
Colorado
area,
here.
Denver
Yeah,
area. Yeah.
Denver area. So, all right. Well, Jessie, this was really fun. Thank you so much for taking time out of what I'm sure is a busy day to have a conversation with us. And we love having these types of conversations. And now, we'll consider you part of our community. So thank you.
Thank you so much. I loved
All
it. All
righty.
right.
All
I'll
right.
talk to you later.
Bye. Hi, Dianne Koehler here again. If you found this conversation interesting and haven't already become a student at NTI, check us out at ntischool.com. We hope to see you soon.